orthopedic specialist Dr. Richard Diana, who helped us shed a little light on what Harvey may or may not be dealing with in terms of thoracic outlet syndrome. Take a listen.
The first thing is to try and figure out what thoracic outlet syndrome really means. And, thorax means your chest and your rib cage, and the outlet means a passage through which, either the nerves or blood vessels or both go. So if you have thoracic outlet syndrome, it means that in your upper chest, that area where the nerves and blood vessels are passing, they're getting squished. And when they get squished, you either don't get good blood flow to the arm or else you don't get good nerve conduction to the arm. And that can lead to, swelling and pain in your arm, to numbness in your arm and weakness. And for Harvey, it's problems with throwing.
Normally, for someone with this condition, is surgery an option more likely than not, or does it differ with a pitcher?
Depends on the severity. If you had a minor case of it, you could possibly get away with just physical therapy and rest and anti-inflammatories, real conservative things. In his case, we're hoping that it's minor, but if it's a more severe problem, then naturally he's going to need surgery. And the surgeries that are done for this are trying to decompress the area where those nerves and blood vessels are traveling. Now, he could either have a nerve problem, a blood vessel problem, or both. And the surgery that's done could be a smaller surgery where you actually just snip a tendon in the shoulder area. That's not that important. Or it could be actually removing the first rib and some of the muscles in that area, which is much more extensive. But there have been other pitchers in the league who have had this surgery and have done relatively well. And I don't know if you remember Josh Beckett. He had that first rib resection, I think, a few years ago. Back further than that, Kenny Rogers had it, and he came back very successful after such a procedure. And there's another guy named Matt Harrison who had the procedure. So there are a bunch of professional pitchers who have had the procedure and done very well with it.